So you've probably seen that healthcare reform has been a big part of the news lately. So a lot of physicians are wondering, how is this going to impact them and the care they provide to their patients? We're at the AOA, we are hearing from osteopathic physicians who are wondering, what's the AOA doing to advocate on behalf of their profession in these conversations with Congress and with the new administration? What is the AOA's position even on healthcare reform? It's important to remember that AOA's membership is diverse, just like our nation is diverse and holds a broad range of political beliefs. But I think what just about every physician will agree upon is that they want lawmakers to focus on healthcare policy that will help them provide care to their patients in the best manner possible. So to sort of get into these discussions, the AOA has identified 4 priorities that we're encouraging lawmakers to use as they figure out how they want to proceed with healthcare reform. We've seen some of these proposals already, and we definitely expect to see more in the coming weeks. And what we'll be doing is comparing each of those proposals to see how they will impact each of those 4 priorities and just how closely each of those proposals align with the osteopathic philosophy. So what are these priorities? Well, the first is that we think a healthcare system needs to have a foundation that's based on prevention and care coordination. The osteopathic philosophy places a really strong emphasis on primary care and prevention. So as part of that, we think that patients should be able to get preventive care without any cost sharing on their part. Second is that the patient-physician relationship needs to be preserved. We think that physicians' clinical judgment, along with their patients, should really be the key driver of care decisions. Third is we need a strong physician workforce. We all know that there's a shortage of residency slots, and as a result, some parts of our country, there aren't enough primary or specialty physicians to really provide care for all those in that area. Last, we need to, and most importantly really, we need to ensure coverage and access to care. So whether it's through a private or public payer, we think any patient should have coverage for and access to a core set of benefits and a broad network of physicians, including primary and specialty care, across all aspects of both medical and behavioral health. We also think that patients shouldn't be charged higher premiums or denied coverage based on either their past medical history, whether they have disability, their race or ethnicity, family history, or gender. And then lastly, there really needs to be a safety net of care that's accessible to the most vulnerable in our nation, of all ages, who might lack the resources to really access coverage directly themselves. If the Affordable Care Act is repealed, one thing that won't go away is MACRA, or Medicare's new Physician Quality Payment Program, which started January 1st of this year. MACRA actually wasn't part of the ACA, although a lot of people think it was. It was passed by Congress in 2015, almost 6 years after the ACA was, to replace the SGR, what some call the doc fix, which so problematically tied a portion of a physician's payment in Medicare to overall national spending costs. So it's therefore best for physicians to find out more about what they need to do to leverage this program's new opportunities for payment bonuses based on the quality of care they provide and avoid any penalties. I think it's clear that there are a lot of changes happening in healthcare and in health policy today, and our hope is that with these changes will also be new opportunities to improvements for the way physicians practice medicine.